lot of these patients that hit the door are really poor prognosis. So for us to see them come full circle, it warms everybody's heart and, you know, makes you keep doing what you're doing each day.
I love working with people and actually helping people to get better.
It really is amazing what the clinicians are able to do. They do perform miracles.
You may work in long-term acute care or an outpatient clinic. Maybe you're behind the scenes at corporate. No matter where you work, under the Select Medical name, one of our brands, or a joint venture, you touch the lives of countless patients and employees. You make a difference every day, and we're proud to have you on the team. We believe teamwork and passion leads to great patient care, and we founded Select Medical on these principles in 1996. Less than 20 years later, Select is one of the nation's largest specialized care providers. Our growth led Forbes magazine to name us one of the best managed companies in America. Today, Select Medical divisions include long-term acute care hospitals, medical rehabilitation hospitals, outpatient clinics, and contract therapy. Our team includes nearly 30,000 professionals from diverse disciplines. Together, we treat everyone from the critically ill to the country's best athletes. That adds up to some 30,000 patients seen each day. We all know the importance of good clinical outcomes, but our real difference lies in creating a great patient experience. That's the Select Medical way.
Making patients feel special starts whenever they first come in the door. It starts with greeting them. It starts with asking them, what are you here for today? Making them feel appreciated and wanted.
The Select Medical way is all about treating the patient with compassion and dignity, and doing what's right for not just the patient but the family, and keeping that at the forefront of all decisions we make. And as long as you do that, almost always things go well and you have good outcomes.
I always try to remember when I go into a patient's room, like that could be my family member, that could be me, and I'd want somebody to treat me a certain way.
It's great when we see people come in at such low levels of functioning, but then at the time they're discharged, they're actually able to perform all their job functions, able to provide for their family and for themselves.
I think, learning, it never stops. And even though, we have a great hospital, we do wonderful things with patients, there's always things that we can do better.
The organization is very accessible, and I like that.
All the OTs are happy to share their knowledge with each other, whether we just see something in the gym and we want to help someone with it or show someone a new technique. After we go to courses and learn new things, we always come back and share it with the other therapists.
You're surrounded by your peers who value the same beliefs that you have, and you're always able to bounce ideas, get feedback off your team, and you're all working together to achieve the same results.
It's nice to surround yourself with positive, happy people that you want to come and see each day.
After 35 years of doing medicine, it's one of the best teams that I've ever worked with.
We really look for people who really want to come here to be a part of something bigger than themselves.
I definitely see my future with Select continuing to grow and flourish, and I think good things are to come.
And we have to do the right thing, and that's always what we strive to do.
When I look at the records and what the nursing notes say and the physician's notes say, there's no doubt there's care there. There are outstanding documentation that tells us that those patients are getting the absolute positive best experience that they could have. And yeah, I would have a loved one come here in a heartbeat.
5 elements make up the Select Medical way. The first is a focus on great employee experience, how we treat you and each other. Other elements include our physical and online environment, our clinical care, our systems and strategy. And finally, our personal interaction model, or iCare. But it all starts with you.
Going the extra mile to say, yeah, I'm going to introduce myself, and I'm not just going to say, hi, I'm Carrie, your case manager. I'm going to say, I'm Carrie, your case manager. I worked here for 5 years. I love what I do. Where are you from? Or making some sort of connection.
Welcome aboard. Welcome to Select Medical.
You're now part of an incredible group of leaders, team builders and problem solvers, nearly 30,000 in all. enough to have a lasting impact across the nation. Despite our size, you'll find that this team feels like family. You may find yourself stretched in new directions or facing new challenges, but together, you can accomplish great things for yourselves, for the patients we serve, directly or indirectly, and of course, for your community.
Seeing patients walk out the door, smiling, that's probably the most gratifying.
Patients, they come back a lot, and they love to share their story. I went skiing for the first time last month. Thank you for all your efforts. Or my son went and played basketball for the first time since his surgery, and he just gets so excited.
At the end of the day, I'm extremely proud to be part of the Select Medical team.
Improving quality of life. That's the Select Medical way.